Effects of growth hormone on fibrous dysplasia of bone. Definition: fibrous dysplasia constitutes a rare mosaic disorder caused by somatic activation mutation of GS. Characteristic manifestations include cafe out leg skin lesions, fibrous dysplasia of bone, and hyperfunctionating endocrinopathies occur with varying severity depending on the embryonic stage at which the mutation occurs.
Fibrous dysplasia. Fibrous dysplasia is a developmental abnormality of the bone that can present with pain and/or deformity. Failure of the bone to mature and realign along the stress lines. Failure of maturation means primitive immature trabecular bone and primitive dysplastic fibrous tissue. And if you add poor mineralization to this, you will get deformities and fractures. The genetic defect involves a G protein that can affect the cyclic AMP. It usually involves the proximal femur, followed by the rib, the maxilla, and the tibia. It is probably a metaphyseal geographic lesion with a classic ground glass appearance, hazy. It may have no aggressive features, and it may have industrial scalloping, different than neurofibromatosis that have periosteal scalloping. It's usually central, but it can be peripheral. So the histology is fibrous and the osseous component. Sclerosis may be present and depend on the content and the extent of the osseous versus fibrous ratio. It will have irregular spicules of woven bone, which is immature bone, without osteoplastic rimming in a bland fibrous background, giving the characteristic appearance of Chinese letters. This is a bone section that shows osteoplastic rimming, which is not present in fibrous dysplasia. Fibrous dysplasia is without osteoplastic rimming. It may contain cartilage tissue, and it spares the epiphysis. It is hot in bone scan. The lesion may produce expansion and thinning of the overlying cortex and create a pathological fracture. In the femoral neck, there will be increased incidence of pathological fractures. The lesion can be monostotic or polyostotic. The monostotic is the physial-metaphyseal regions of long bone common in the proximal femur. It can cause varus, shepherd crook deformity. The polyostotic, only one side of the body, the lower extremity and the homolateral pelvis. 20% of the patients with fibrous dysplasia have multifocal disease with associated endocrine abnormality. They call it McCune-Albright syndrome. You can get precocious puberty, cafe au lait spots. The endocrine abnormality can be Cushing or hyperthyroidism. and cafe au lait spots like a coast of Maine. It has a regular border, which is different than the coast of California appearance, which will have a smooth border. It occurs in neurofibromatosis. McCune-Albright syndrome is a genetic mutation of the G genes, polyostotic, unilateral, precocious puberty, short stature. Treatment of fibrous dysplasia, usually observation in the absence of impending fracture or deformity. Fibrous dysplasia is a benign lesion, but if it occurs in the femoral neck, it can cause fractures. You want to do curettage of the lesion plus cortical strut graft and internal fixation. The cortical strut graft is better than the cancellous bone. When you use cancellous bone graft, it is usually replaced by the host bone, which is a dysplastic bone. Therefore, cortical allografts are better. Thank you very much. I hope that was helpful.
Treatment. Although fibrous dysplasia is a genetic disorder, it occurs because of a genetic mutation that is not passed from parent to child. This disorder has no cure. Treatment, which may consist of surgery, focuses on relieving pain and repairing or stabilizing the bones. Education in medicine. See your doctor if you or your child have any of the following options. Bone pain that increase with weight lifting activities or that doesn't go away with rest. Bone pain that interrupts sleep, difficulty walking, or lamines swelling with no apparent cause. Change in the shape of the bones, difference in line length.
So today I want to talk to you about fibrous dysplasia, and basically it is dys, which is not normal, plasia, which is growth of fibrous tissue. So fibrous tissue is replacing your normal bone. And so when you have a normal bone, for us in neuro-ophthalmology, we're usually thinking about the skull. So in the skull base, what we're worried about for fibrous dysplasia is the vision, and so the optic nerve is just medial to the anterior clinoid and then goes to the orbit. And so when we have fibrous dysplasia involving the sphenoid bone or the skull base, it can affect the optic canal, which is cranial nerve 2. So this is the main way fibrous dysplasia comes to me. However, because the orbit also includes the muscles and the optic nerve in the orbital portion, maxillary fibrous dysplasia, or any paraorbital fibrous dysplasia can cause ophthalmoplegia, proptosis, and diplopia, and the loss of vision. So we've got the orbit version, and we've got the intracranial versions of fibrous dysplasia. It comes to me as double vision or orbital symptoms and signs, proptosis, ophthalmoplegia, optic neuropathy, or the intracranial version if it's close to the canal, So the anterior skull base is the fibrous dysplasia that we see in neurop. There's two forms, a monoostotic form, which means only one bone, or a polyostotic form, which means more than one bone. And sometimes you have polyostotic as part of a syndrome, the syndromic variety. And the syndrome that we're worried about is called the McCune-Albright syndrome. The McCune-Albright syndrome is associated with polyostotic fibrous dysplasia and endocrinopathy. The endocrinopathy is too much hormones, and the too muches could be hyperthyroid or Cushing's or too much growth hormone. It's basically a hormone excess thing. In addition, they can have cafe au lait spots, just like in neurofibromatosis type 1, but the cafe au lait spots in McCune-Albright are often described as coast of Maine because they're very strange border and extensive cafe au lait. So it's like a big cafe au lait spot with a squiggly line border, just like the little coast of Maine islands of the state of Maine. So it's like a state of Maine cafe au lait spot. And so you need to know about fibrous dysplasia. It is dysplastic, not neoplastic. It can affect the skull base. When it's anteriorly, it can produce orbital signs or optic neuropathy. It can be monoostotic, polyostotic, or syndromic. If it's syndromic, the syndrome is called the McCune-Albright. That's associated with cutaneous manifestations, coast of Maine, cafe au lait spot, and also the endocrinopathy, excess states. And normally, this is a kid thing. The average age is like 10 to 20. So it's rare to see this when you're older without having had a CAT scan at some point. Most of the patients are asymptomatic. In the long bones, it can cause pain. That's orthopedic surgery is going to see that. When it comes in the skull base, it comes to us as double vision or loss of vision. There's no real treatment. It's not hereditary, but it is genetic. And the reason it's that is because it's a post-zygotic phenomenon. So the zygote is already formed, and usually it's from mosaicism. So you've heard that term probably in other videos, where not every cell in your body is the same genetically. And that can occur from heteroplasmy, from mosaicism related to the X chromosome, or in a post-zygotic fashion. Mosaicism can cause chromosomal abnormalities, usually from disjunction or anaphase lag, where the little spindle breaks and one cell gets all the chromosome and the other cell doesn't get all of it or half of it or none of it. And that causes a post-zygotic problem in the control mechanisms in the bone that leads to the formation of fibrous tissue in the wrong place, and we call that fibrous dysplasia. There's no cure. There's some treatments. Bisphosphonates sometimes used to control the phosphate metabolic error in bone pain, but from the neurop standpoint, really don't have good treatments. You could decompress it. It can undergo cystic degeneration and cause a mass lesion, and rarely, less than 1%, fibrous dysplasia, which is normally benign, can undergo malignant transformation. So you need to know a little bit about fibrous dysplasia, especially when it's near the canal or the orbit.
Pros and cons. Fibrous dysplasia can cause few or no signs and symptoms, especially if the disease is mild. More severe fibrous dysplasia can cause bone pain, usually a mild to moderate, dull, ache, swelling, bone deformity, bone fractures, especially in the arms or legs, curvature in the bones of the legs. Issue apply in Ecuador. The prevalence worldwide is approximately 1 of 2 millions. There is no racial, geographical, ethnic, or gender predilection. Conclusion: in most cases, fibrous dysplasia appears in only one place in one bone, but it can appear in several places in different bones. Single bone disease usually occurs in teenagers and young adults. Typically, people with more than one affected bone have symptoms before their 10th birthday. Although fibrous dysplasia is a genetic disorder, it occurs because of a genetic mutation that is not passed from the parent to child. This disorder has no cure. Treatment, which may consist of surgery, focus on relieving pain and repairing or stabilizing the bones.